Okay, we're here with Mr. Patel 4 days after his HD non-cutting LASEK. And he's a very special, interesting case because Mr. Patel had nystagmus. And nystagmus is your eyes moving back and forth always. Since birth, it was congenital. And he's got a very interesting story and a great success. But before we talk about his success, let's ask Mr. Patel what his problem was and what the doctors back in Florida thought, because he came all the way from Florida.
So I went to multiple doctors that treated people for LASIK, and they all told me, no, you can't do it because you have nystagmus. Every time I went in, it was like a 5-minute pre-op thing, and they would just test me for nystagmus, and then once they found out I had nystagmus, they would tell me no. So I was just
like a quick no.
Yeah, it was just like a no. Yeah. And then
but there was one case that we did went to go see a doctor, and the doctor took all the information and it says, let me research and get back to you. In that case, the doctor, we call, and we never got a reply back.
That's bad.
And
because he kind of gets your hopes up.
Yeah, it's my hopes. So even though I went to see him at the office, he refused to see me because he could not handle this case at all. That was the bottom result of his decision was.
They told me I had to shave the eye muscle down before they could.
What?
Yeah.
Dude, that's crazy.
Yeah.
That's crazy. Yeah, that's crazy. I think they're saying they want to do something about his eye muscle to decrease the amplitude of his nystagmus. But we've lasered people much worse than you, by the way, because our laser tracks huge amounts of nystagmus. We have the LASIK laser. It's the most expensive laser in the country, and it's got, I think, one of the best trackers in the world. And basically, as long as your nystagmus is like yours, even worse, you can track. So I told you over the phone, I think we did a remote consultation and we did a video consultation. I saw the amount of nystagmus you said. I was confident we could do the case, but I did tell you, if necessary, we have a fixation ring. I could hold the eyes. I mean, look, I'm a cornea refractive surgeon. This is really all I do. I've done 20,000 cases. Clearly, if you go to some person who's done a few thousand cases, no. And then we do many, many specialty cases. I would say 10 to 20% of our cases are people who can't get LASIK. Anyway, there is a fixation ring that you could hold the eye down with, and then even if you had wild amounts of nystagmus past what our laser could track, we could hold your eye down. I did warn you about that, but we didn't need to use it at all. And then the laser tracked you so well that we did it in one shot. It wasn't like you moved and we had to start all over again. And then we also talked about a null point. So you have a little point where your nystagmus is less. I think it's a little bit in right gaze. So during your procedure, we had you a little bit off center, looking a little bit to the right to make the null point. And then the null point is where you have the least nystagmus. And you figured this out, I guess, over your life, right? The null point thing? Just accidentally or something, right?
Yeah. No, well, I'm in nursing school, so
you learned
about it, and I looked for it for myself.
Oh, interesting. So before nursing school, you didn't know about the null point.
No.
Somebody should have told you, one of the doctors, because then you could just investigate the null point, and it's also cosmetically better because your head moves less.
Yeah.
And what's interesting now is after the procedure, only 4 days out, and both myself, your father, and Dr. Dovjik, who's doing the video, she's my MD PhD assistant. Wanted to thank Dr. Dovjik because we couldn't have done the case without her.
Yeah.
We all noticed that you actually have less amplitude, a smaller amplitude of the nystagmus, and less head motion 4 days out, which is like a bonus, really.
And that's the thing, we were looking forward to it so he can see better, less nodding and nystagmatism, and I think it did a good job. Thank you, doctor.
We just did a auto refraction on his prescription, and then he only had 2 diopters of myopia, not that bad, but you had 3 diopters of astigmatism, which is very, very high. We got rid of all of it, and right now he's seeing between 20/30 and 20/40, which is just like he was in glasses or contacts. And you have to understand he's only 4 days out. So within a week or 2, he's going to see slightly better than glasses or contacts. And in a month or 2, he's really going to say, wow, this is the best I've seen in my life. Better than glasses or contacts. We got rid of his myopia, we got rid of his astigmatism, and we also got rid of some of the nystagmus, which is going to help his acuity a little bit. So now your father was telling me he's a big Cubby fan. He's hoping now he could finally teach you how to hit a baseball.
Yeah. Before I couldn't see the baseballs. There was this one time where there was a fly ball and I was in center field, and my coaches were like, Rahi, we're like, what? look up. I'm looking up. I can't find the ball anywhere.
And
It lands right in front of me, right there. All I had to do is hold out my glove and I would have caught it, but I couldn't see it.
And look, we think your life is going to be better. We wanted to thank you and your father for doing this video. We're going to try to put it up on YouTube. There must be 10,000 people in the United States right now who have astigmatism, and unfortunately, their local eye doctor told them that nothing could be done. Mr. Patel is living proof that not only could we help you, we could make you see better than glass or contacts, maybe decrease the amplitude of your astigmatism, and really change your life, and that's what we're here for. So, what are you looking forward to doing in your life, both work and play, that you couldn't do before? What are some of these dreams or aspirations, Mr. Patel?
Well, I mean, I like bowling, so like whenever, like the only problem that I had when I was bowling before was I would always throw the ball towards the gutter because I couldn't really see where the pins were. But now I'm hoping I can throw it straight.
Okay, so next time you go bowling, you have to take like a little video and give it to us, and we'll put it up and stuff like that.
Sounds
we also
good.
wanted to thank your father. He's been very supportive, very loyal, helping you come all the way up from Florida. And then when we talked on the phone, he was like, "Oh, don't worry about the money. I'll just take care of it. I just want the best for my son." So it's really a very touching experience to see a family so close as yours.
Thank you very much. Yeah.
Okay, thanks a lot, and thank you very much, Dr.
Thank you.
Dustin.
Thank you.
Congratulations.
Thank you.
Appreciate it.
Looking forward to it.
Thanks.